Good morning, everyone, and welcome to the Northern Regional Childhood Lead Poisoning Prevention Healthy Homes Coalition. This is a joint coalition meeting. So since we are unable to meet in person, today is going to be a little bit different. We're meeting virtually. So thank you all for attending. And I just want to start off with going over the agenda. If you all see in the handouts, we have the meeting agenda available for you to look on. So I'm going to start off with a Healthy Homes and COVID-19 presentation by myself, Melissa Middlehauser. I'm the program coordinator for the CLIP and Healthy Homes program with the Partnership for Maternal and Child Health of Northern New Jersey. Next, we have a special guest, Hector Marino from GTI, which is Green and Healthy Homes Initiative, followed by some clip announcements of our program, and you will have the opportunity to share your updates as well and announcements. After that, we will have a lead detectives video that Alanis has created, and that will be shown at the very end. Okay, during the presentations, you can write in your questions if you have questions, and then they will be asked at the end of each presentation. Okay. Okay, so we're going to start off with the COVID-19 and Healthy Homes presentation. This is a presentation that is new for us. We created, generally, our education is on healthy homes as well as lead poisoning prevention, but due to the circumstances right now, we included a piece about COVID-19. Okay. So for this program is provided by the Partnership for Maternal and Child Health in Northern New Jersey and sponsored by a grant from the New Jersey Department of Health. During this presentation, we will discuss ways to keep you and your family safe while home amid the coronavirus pandemic outbreak. So this is a presentation that is geared more towards parents. So this is something that, we can either coordinate to have this presentation done, or you can use this as a guide. So our goal is to educate New Jersey residents on the principles of a healthy home in order to create and maintain safe and healthy homes in all communities. Americans spend a majority of 90% of their time indoors, either in their homes, schools, or other commonly visited places. It is important that while families are inside of their dwelling places, are safe, clean, well-maintained, and hazard-free. Since the recent outbreak of COVID-19, aka coronavirus, the amount of time people are spending home has increased, so it is even more important to assess any hazards in the home and fix them appropriately. So what is coronavirus or COVID-19? It is the new virus that continues to spread around the United States and other countries. It spreads easily from person-to-person contact through droplets that are produced when a person sneezes or coughs and another person inhales or ingests them. The spread is more likely when people are in close contact with each other that have the virus, and currently we do not have a vaccine to prevent contracting COVID-19. What are the symptoms? So the symptoms have been cough, shortness of breath, or difficulty breathing, fever, chills, muscle pain, sore throat, new loss of taste or smell. The at-risk populations for COVID-19 include people who are 65 years or older, nursing home or long-term care facility residents, people with underlying health conditions, including chronic lung disease or asthma, serious heart conditions, the immunocompromised, obesity, diabetes, liver disease, chronic kidney disease, undergoing dialysis. Okay. It is also important to note that children and even younger adults can contract the virus as well. Some may even be carriers of the virus without knowing because they can be asymptomatic. So there are many triggers. Asthma can be a trigger for COVID-19, as well as there can be triggers in the home. So we want to, relay the information of like COVID-19 and make the connection with keeping your home healthy and safe and the importance of that. So the underlying asthma triggers in the home that can be harmful to people include mold, pests, such as roaches, mice, tobacco smoke, household products, dust, and pets. Okay. All of these things can be found inside of a home, and it is important to look and monitor them so at-risk populations can be safe. People with asthma should continue to treat their condition regularly and stick to their asthma action plan provided by their physician. This is just some other facts about COVID-19 and how it survives on different surfaces. So it can stay on surfaces of copper for up to 4 hours, on cardboard for up to 24 hours, and up to 72 hours on plastic or stainless steel. So you want to make sure commonly touched surfaces are disinfected regularly, and when receiving packages, leave the package untouched for 24 hours or spray it down with a disinfectant before touching it. Okay. So who should wear face masks? This has been debatable, but we advise that all individuals over the age of 2 in public settings should be wearing a face mask. With COVID-19, since it is a respiratory, contracted disease, protecting your face, your mouth, your nose can reduce the risk of contracting it and spreading it. Who shouldn't wear the mask? Children under the age of 2, and individuals who have trouble breathing or can become like incapacitated or otherwise unable to remove the mask without assistance. Okay, so the 8 principles of keeping a healthy home include keeping it contaminant-free, well-maintained, keeping it dry, keeping it pest-free, keeping it well-maintained, keep it pest-free, keep it well-ventilated, thermally controlled, keep it safe, and keep it clean and dry. So just to go over what these principles mean and just, to get more in depth, the first one, keeping it well-maintained. So you want to make sure that you inspect, clean, and repair your home often. Take care of minor repairs and problems before they become larger headaches. The second one, keep it dry. You want to stop water from entering your home through leaks in the roof, bad plumbing, or poor drainage. Constant wet areas can lead to mold developing. Number 3, keep it clean. Control the source of dust and toxins. Create smooth and cleanable surfaces, reduce clutter, and use wet cleaning methods. This is especially important. We talk about lead poisoning and leaded dust. So if there is dust, there can be lead in the dust, and keeping dust-free surfaces is also important to reduce lead exposure. So keeping it safe, number 4, you want to properly label and store poisons out of reach of children. Secure rugs and keep children's play areas free of hard and sharp surfaces. Number 5, keep it contaminant free. Reducing hazardous household chemicals use is one way to prevent allergies, skin rashes, and asthma attacks. Number 6, keep it pest free. All pests need food, water, and shelter. So be sure to make no home available for them. Seal all cracks and openings where pests might get into. A quick notice that mice can fit through a hole the size of a dime, and rats can fit through the hole the size of a quarter. So be sure to go around your home, make sure that there's no holes or cracks. If there's any food, you want to make sure they are in pest-free containers and put away. Number 7 is to keep it well ventilated. You want to ventilate bathrooms and kitchens with fans and open windows to supply fresh air, especially when you are cleaning. And number 8, keep it thermally controlled. Maintain comfortable temperatures in your home to prevent extreme heat or cold. A home that is too hot can lead to heat exhaustion, or a home that is too cold can lead to hypothermia. So here are some tips for cleaning and disinfecting your home. You want to wear disposable gloves when cleaning. Practice routine cleaning of frequently touched surfaces. For example, tables, doors, knobs, phones, keyboards, toilets, etc. Change the air filter in your home every 3 to 6 months. And use products with at least 70% alcohol for efficient disinfecting. So what is the difference between cleaning and disinfecting? So cleaning just involves using soap or detergent and water to remove dirt on surfaces or objects. It doesn't always completely kill germs, but lowers the amount of germs and prevents the spread. And disinfection works by using chemicals to kill germs on surfaces and requires using EPA-approved disinfectants such as Clorox or Lysol products. Together, using these two methods is sanitation. Okay. You want to keep your home safe when someone has COVID-19 or may have COVID-19. Some things that you can do: keep a separate bathroom and bedroom for the sick individual if possible. Practice social distancing and wear a mask when around others to prevent the spread. If it's possible, eat in a separate room. You want to make sure that you wash utensils with hot water after use. And here are some resources that you can share with families if they have more information or questions about COVID-19. So the covid19.nj.gov for up-to-date information, what's happening with New Jersey. Supporting children during COVID-19, there's a great, nj.gov has the education and tools for families and families with students. Remote learning resources are there as well. And you can contact your children's school for additional resources. Okay. If there's any questions on rent or mortgage, there's eviction protections during this time. If someone is facing eviction or potential foreclosure, they can contact the njhousing.gov. The number is provided as well as the website. New Jersey residents will, at the beginning of quarantine or COVID-19, the New Jersey residents who were struggling financially were given a grace period of 90 days for mortgage payments. There's also information on rental relief. Here are some food assistant resources, SNAP, Community Food Bank of New Jersey. Okay. So I want to thank you, and everyone stay safe. If you have any questions or concerns or want to, contact us for this presentation, feel free to either email us at info@partnershipmch.org, or you can email myself at it's my last name, it's a really long last name, at partnershipmch.org. That information will be given to you. Okay, so thank you so much.
Hi, Melissa. We have 2 questions. The first question says, over the past few weeks, it seems like less people are wearing masks. How can we effectively incorporate the message of wearing a mask in our work preventing lead poisoning?
That's a very good question. So with this presentation, we are working with our regular outreach participants. We have worked with family success centers, and we're aiming to get the word out there. Also follow us on social media, where we continually post information. Definitely wearing your mask is important to reducing the spread. It's also important to protect your family. As we advocate for parents and educate parents, that is something that we definitely mention to our parents.
And we have one more, which I think you answered, but is this presentation available for you and the CLIP team to present to the community and company employees virtually?
Yes, absolutely. So if you are interested in us presenting or doing a program for you or your program, or someone that could benefit from this, feel free to reach out to myself, Alanis. Alanis is also bilingual, so she's able to present in Spanish as well. So yeah, we definitely are eager to get this information out there. We also do provide our regular lead poisoning prevention programs, but since COVID-19 has taken precedence, we have this now available, and we want to get it out as soon as possible.
One more, what was the number of the food resources? I think somebody needs the number for the SNAP, I think it was.
Let me see, can I go back to the presentation? Or no?
Yes, you're not on camera anymore with the presentation.
Okay. For SNAP, you can call 1-800-609-3663. I'll just leave this up here for a few seconds.
I think that's all the questions that we had so far.
Okay. Okay, so let's see. Okay. All right, thank you so much, Alana. Okay. All right, so moving along, at this time, I would like to introduce our very special guest speaker, Hector Marino from GHHI. Hector is the Housing Assessment and Quality Assurance Manager, Building Performance Subject Matter Expert with GHHI, which is Green Healthy Homes Initiative. Hector Marino oversees the quality assurance and quality control program for the housing interventions, and as GHHI's building performance subject matter expert provides technical support GHI sites in housing, environmental, and energy matters. Before coming to GHHI, Mr. Marino worked for 16 years at the U.S. Environmental Protection Agency in Cincinnati, Ohio, as a microbiologist and environmental scientist. He later joined the Cincinnati Health Department in Ohio, where he worked as environmental health sanitarian, enforcing food safety codes and addressing indoor environmental factors affecting public health. Mr. Marino holds a Master of Science and a Bachelor of Science in Biology from the University of Puerto Rico. He is fluent in Spanish, and he is an active member of the National Environmental Health Association, a licensed pest control operator in Maryland, mold inspector, a Building Performance Institute certified energy auditor, and BPI quality control inspector. So without further ado, thank you so much, Hector, for agreeing to come on and share with us about virtual healthy home assessments. Originally, I had seen their webinar, and I think it's amazing what they're doing. And based out in Maryland, I think that you can shed some light on some ideas and, for our members here.
Thank you, Melissa. Good morning. Good morning to the audience. Okay, good morning, and thank you. I'm glad to be here today. Thank you to the coalition, Melissa, Monica, and the rest of the team for the invitation and opportunity of being here today, of presenting here today. Today we're gonna talk about what we have been doing in Baltimore and in other sites that we have throughout the U.S. in terms of how to adjust. We have been adjusting our operation to the COVID-19 situation. So to give you an idea, this is basically what we're going to be talking today. This morning, we're going to start with the rationale behind the reason why we have adjusted all our operation, which is kind of obvious. The COVID, the social distancing, so we cannot do our regular service, and we cannot provide our regular services as usual. So what's the rationale behind it, and how we came to develop the approach that we have been implementing? And then after that, then I'm going to dissect a little bit our approach, so you have an idea of how we do it, and then give you some examples, some photos, some of different virtual assessment that we have been conducting lately. And then at the end, kind of like talk about what are the next steps in our plan to implement and expand this approach. Next slide, please. So to give you some context, the GHHI was founded in 1986, and as a coalition to end childhood lead poisoning. That was like 34 years ago. And then in 2009, then we became the Green and Healthy Homes Initiative, with the idea of expanding our scope and scale in order to more effectively, more efficiently break the link between unhealthy homes and unhealthy families nationally. And since then, GHHI has been collaborating in projects with different partnerships across the U.S., building stronger, integrated, multi-intervention home visiting programs with proven health outcomes. So basically, that's what we have been doing, and that kind of to give you a context that, yeah, we do things locally in Baltimore, in Maryland, but most of what we do also gets shared with our partnerships around the nation with the different collaborations, the different partnerships we have. Next slide, please. So, oops, I think that was okay. So basically, again, to give you some context, because of the pandemic, then GHHI decided we have to find a way to provide these healthy home services to families with the same level of consistency and quality that we had before of that. So the objective then became like how can we develop capabilities to adapt what we do already with the housing services that we provide, how we adapt our services to this new pandemic reality. So the strategy became kind of like, okay, let's not reinvent the wheel. Let's find out what's out there that we can implement. We can adapt our model, and then try to again be able to provide our services during these times of crisis. Next slide, please. So, also for context, to give you an idea, our model, our GHHI model is what we call a whole house strategy, or comprehensive strategies. It's a multi-intervention, multi-hazard approach, a multi-intervention, because we combine in our home visiting programs, we combine education, assessment of the home, and also then the home modifications. And then it's multi-hazard, because then we try to at the same simultaneously kind of address lead-based paint hazard, asthma triggers, injury hazards, radon energy efficiency, and so on. The only way we can accomplish the only way we can be successful in what we do is by having a cross-trained crew of comprised by home assessors, environmental health educators, and crew which are going to be addressing all these issues in a holistic, comprehensive manner. Next slide, please. So the idea was kind of like, okay, we have the strategy, we know what we need to do. We decided what's going to be the strategy. So as I mentioned before, okay, let's not reinvent the wheel, and then go out there and find out, identify which groups are out there, maybe using virtual home inspections or virtual assessment, and then find out what kind of virtual platforms they are using, and see to some extent to find out if our protocol could be easily adapted to what other people are doing there. And next page, next slide, please. So what we found out there, it was kind of like interesting. It was kind of like there were people, there were organizations using virtual home inspections, but it was more like in a limited fashion. There was kind of like they were more like targeted inspections, for example, for home insurance purposes, housing code inspections, food inspections, mold inspections, and kind of there were also for patients that they were kind of released recently from the hospital, to kind of like monitor those patients on the first days, first weeks after coming back from the hospital. So that was kind of like the first level of information, kind of like to realize that there were not hardly anyone doing kind of the multi-hazard type of approach to it. And also number 3, for example, there were the approach that they were taking was more about like sending a representative from the company or their agency to the home, and with the camera, not the camera, but with either with a tablet or a smartphone, and then that person would be facilitating the inspection in the home. In the meantime, there was an expert back in the office, like over the computer, kind of like also analyzing the video feed from the person at the house. As a note, I mean, what we do at GHHI, because of social distancing, we cannot send a rep to do that kind of work. So we rely heavily on the client, on the family member, on the homeowner, on the tenant, through their smartphone or tablet to actually be a part of the assessment. Basically, we become a team in which the client or the homeowner or tenant kind of like with the assessor, basically we move together around the house to complete the assessment. But so far, and then number 4, that's what I mentioned before, that most of these pictures, they are not multi-hazard, they're multi-intervention framework. And the next 2 are really important. There's not much standardizations across applications. For example, I mean, what I mean with that is like, there are not all the people that were applying this type of approach, there was no communication between any. They were not following any type of guidelines or standards. So that was kind of like really, it was surprising, but in reality, it was expected. And number 6, limited information on client safety, liability issues, HIPAA rules, etc. So 5 and 6 are really important for us, since we, again, what I mentioned before, what we do in Baltimore, in Maryland, we share with other people. So standardization becomes really important for us, because we want that everyone that we are partnering with, we reach similar conclusions following similar guidelines. We don't want people in one jurisdiction calling what is red blue, and then other people in your jurisdiction calling what is white black. So it's kind of like we have to make sure that across the board we are on the same page, and standardization then is really valuable for us. And then the limited information about safety is also becomes really important, as well as HIPAA regulations. But in terms of safety, since we're working with the client, we have to be really, really, really careful or considerate of the client. I'm going to get a little bit more into that a little bit later in the presentation. So next slide, please. So when we then came up with the, after compiling all that information from the field, then we decided, okay, let's plan out, let's write down what's going to be the approach. And so the first, number 1 was kind of like, let's make it, whatever we create, whatever is the strategy, the virtual healthy home strategy, is going to be part of a continuum, meaning it's going to be, we're not going to create anything new. We're going to integrate our proven GHHI comprehensive education, assessment, and intervention model. We're going to, it's already proven that it works, but then we're going to now implement that into the virtual platform. For us, it needs to have a high level of equivalency to the in-house healthy homes. We want to make sure that there's some resemblance. The closer you have the virtual home assessment to the in-house home assessment, more confidence, more reliability, and then because of that, then more people, more groups, it's become more accepted in the industry. And then also it's important for us to be validated through quality control oversight. Video recording would be really important for us, so we can improve our protocols, our guidelines through video recording, and kind of like overseeing the operation to make sure that we're always improving our guidelines or standards. And then supported by guidelines, that's going back to standardization. We need to create tools it doesn't matter if you have a 20-year veteran in the industry, there's going to be some level of equivalency between the person who is 20 years veteran and the person that has 2 or 3 years in the industry. So to basically balance that out, we produce streamlined guidelines and checklists to help that person that may not have the 20 years of experience, but also with all these other tools, kind of like makes the work better, more efficient, more reliable for people that don't have that level of experience. And then what I mentioned before, whatever we do has to be adaptable to all different users, not only home assessors, but community health workers and other healthy home professionals. Next, please. So here to give you an idea of what are going to be those components of the strategy. Obviously, there has to be a mobile device, smartphone or tablets, something that is familiar, easy to install and to use by the client. We need to find a video platform from the client's perspective. Again, it has to be familiar, easy to install or use. And then for the home specialist, it has to be one platform that would allow the capability for recording, to take photos, to provide good video, good sound, etc. And then number 3, or what I mentioned earlier, the protocols, guidelines, and checklists that would have to be well defined and together with the safety guidelines for the clients. Next slide, please. So here to give you an idea about safety, because again, what I mentioned before, the client, the tenant, the homeowners becomes our partner in that home assessment. Then we have to go through some safety check first with the client to make sure to determine the level of mobility of that client that is going to be participating in the assessment. If that person is not mobile, maybe we can rely on family members to be present and also help us with moving around the house. We have to be conscious that not to go up and down the stairs all the time. I mean, make sure that in our protocols, we are organized and we are really well organized. So we don't, once we inspect one area, we don't have to trace back and to avoid all this extra movement around the house that is gonna affect the mobility of the person, because it could get tired. Avoid obstacles, avoid areas like crawl spaces and attics that are really dangerous for us to take the homeowner into those areas. So those kind of like examples of considerations. Number 2, safety tips for clients to avoid trip, fall hazards, what I mentioned before, avoiding attic crawl spaces. And then really important, keeping in mind that the client is not going to have the PPE or personal protection equipment that we normally use. So because of that, we have to be aware that not to get the client, the homeowner, or the tenant too close to the hazard. If, for example, I'm talking about mold, other pollutants like asbestos, make sure if areas that may be dangerous to move around just to avoid those areas. And then because all that, then considering the mobility and the health of the person, then we have to be conscious that we're gonna keep the virtual assessment to a maximum of 60 minutes to consider the health and stamina of the client. Next slide, please. And then, in addition, our really second most important aspect or requirement for a virtual strategy is having all these what we call virtual home assessment tools, which basically is gonna lay the foundation for even out the condition for any assessor, any community health worker to be able to then jump in and be able to identify hazards through the virtual platform. And kind of an examples of these assessment tools is, for example, one would be the comprehensive health and safety assessment guidelines that all these are like forms and checklists and documents that we produced for our own assessor that then we share with other people. And for example, comprehensive health and safety assessment guideline, which basically tells you what are the most common hazards that you're going to find in the house and where to look for them. That kind of like to create that foundation to whoever is doing the platform. They understand the hazards, understand where to look for them. And number 2, virtual home assessment protocols to kind of like giving the assessor, the educator, the tips of what things to consider in the process, and like safety of the client, time of the session. And number 3, target list of hazards. You need to know what you're looking for. It's since you're doing it virtually, sometimes you lose track of time, you lose track of where you are. So you have to have it. You need in front of you a target list of the hazards you're going to be looking for. So you stay in target, you stay in your mission. And then the other things, a standard work specification, meaning how things are going to be repaired, scope of work, how to do a scope of work, and then recommendation for hazard mitigation. Since we are not there now because of the COVID regulations or the different jurisdictions, different governments, they are not allowing this work to start. So in the meantime, when we write a scope, here, at least for here in Baltimore, we are not allowed to do home work in the house yet. So when I write the scope, I include recommendations for the client for hazard mitigation. Like in the meantime, in the interim, while we get to your homes, these are measures that you could do. You could implement in your home to kind of mitigate the effect of whatever hazard you have. Next slide, please. And then other additional considerations that kind of things to consider, but I'm not gonna get too much into this today. But I'm kind of like technology, what type of access the client would have to different platforms, including Wi-Fi or data limitations, kind of things that may determine the eligibility of that client to have a virtual home assessment. Privacy issues, maybe the client is not willing for us to either to record the session or to do a virtual home assessment. So again, these are kind of like privacy issues that still they are being the government's still trying to come to resolution on that. And this is a good reference for you to look into how the U.S. Department of Health and Human Services kind of like recommendations that they're putting out in terms of HIPAA rules in these times that people are relying on all these like remote communications. And then also a really good thing for you to keep in mind is developing a client relationship virtually. You have to make the person comfortable on how things are going to develop through the assessment, and because of that, I'm going to talk a little bit more about that. But kind of like how do we prepare the client ahead of time to make sure that the client feels comfortable during that time. The next slide, please. So here, kind of like give you a glimpse of what we have done and how we have rearranged our protocols, our in-person comprehensive assessment versus now the virtual home assessment. So we start with the same intake, especially like kind of taking in the request for virtual assessment. And then what we do is like we have, instead of like having the home assessor and the client educator together as we were doing it before, now we are kind of like dividing that. We have a project coordinator that is going to interact with the client before the virtual assessment. It's going to make the client more comfortable with the process, what things are going to happen. That the project coordinator is going to make sure that the person have the required platform and smartphones or tablet, and then this project coordinator also is going to kind of like record some level of information for the home assessor. Since the home assessor doesn't have too much time, we need to get as much information ahead of time, so when we do the assessment, but then we can move faster and be able to plan ahead of what we're going to do, what we're going to be looking for. And then we write a scope of work that is going to include the client mitigation measures. And then at the end, that's when we have the client education. And after that, at some point, then we move back to house modifications when we are allowed to go back. Next slide, please. Virtual home, like everything in life, there are some advantages and disadvantages. I think that the three more important advantages of this system, of this approach, is the fact that, I mean, you are providing access to limited but effective home assessment and home modification to the client. Also, it can be used to identify a range of health hazards, such as lead hazard. I mean, you can do a comprehensive assessment with some limitation, but at least you're doing a comprehensive assessment. And then number three, enables a healthy home professional to prescribe those home modifications to anyone with a smartphone or tablet. So it kind of like open the opportunity for people to start to receive these kind of services that maybe in the past were not they were not for X, Y, or Z reason, they were not receiving. Next slide, please. In terms of disadvantages, so I've been talking about that already. Older clients might not be comfortable with the technology, limited, everything's going to be limited by the mobility or health of the occupant. The time is going to be limited, no access to attics or crawl space due to safety issues, no environmental testing, water temperatures, carbon monoxide, lead hazards, asbestos testing. But I mean, those are things that we were not doing anyway early on. If we had to test for mold, asbestos, or lead, we would get a third party to do all the testing. But water temperature and carbon monoxide, there was no such things that we were doing. But again, we are not able to do it. There are things that we can go. There are ways to go around these limitations and not to make them such a big obstacle. But in general, those are like, this is an idea of what are the disadvantages in comparison with an in-person assessment. Next slide, please. When I talk about the client's triage interview, that's when the project coordinator interviews the client previous to the assessment. We try to gather a lot of information on the home, and that information is going to be fed to the home assessor, for the home assessor to be able to plan ahead and develop a plan of action, plan of attack for those 60 minutes that we're going to be in that house. Then can make sure that we have all the background information already in our brain, being digested in our brains, and then we are able to do the work more efficiently. Next slide, please. And here kind of like a couple of examples of a couple of slides to show you the different views, different quality of picture that you're gonna get into this implementing this type of approach. For example, on the if you click at one, Monica, if you click at one, there's an arrow that is gonna pop. Here, okay. So in this case, this is gonna be a trip hazard that kind of like, in this case, the client was used to have that wire, that cable on the floor. So for the client, that was not an issue. So, but then the assessor was kind of like, oh yeah, definitely that's a trip and fall hazard. We need to do something about it. So again, it's like things that maybe the client might not be thinking about it, but then that the idea for us is to look at everything and identify as many hazards as possible. On the one in the middle, then you see there's a mold on the wall that kind of like, you don't have to be too close to identify some mold. That's basically the point of the slide, that with experience, with all the assessment tools that we provide, it's kind of like it makes it easier for the assessor to look at things virtually without having to get too close. Then on the slide on the right, then you see some chipping paint on that handrail going down the road. So it kind of gives you an idea that the hazards kind of like are if you have a good smartphone and a good computer, you're gonna be able to see some details on the pictures. And then the idea is, so I take pictures from different angles, and to make sure that when I'm analyzing the home, the situation, the assessment, I have different perspectives to compare. Next slide, please. And here again, 3 more examples. On the one on the left is it's basically water leak on the ceiling on the 2nd floor. The one in the middle shows you water infiltration in the basement. So yeah, you don't see the one in the middle. You don't see the water, but you see the footprint of that water. So you can, with good education, with good assessment guidelines, assessment tools and guidelines, you can infer that, yeah, that's the signage for water infiltration in the basement. And then on the slide on the right, basically it's to indicate like also if you are looking for safety hazard for elderly or for children, you're also kind of looking for what's not there. In this case, the lack of handrails. I'm sorry, the lack of grab bars in the bathroom. So again, it gives you enough resolution for you to be able to identify problems in that house. On the next slide, please. So here, kind of like it's really kind of like noisy, but this is an example of a virtual assessment report or scope of work, and including observations and recommendations. So the column on the left, the first column on the left, is basically what are the most important hazards that were identified during that virtual session. They might not be everything because again, there's certain limitation through using the platform. Is not the same as an in-person assessment, but at least give you you're able to identify what are those. For the most part, you're able to identify those major hazards, and then the assessor needs to prioritize. We don't have all the resources in the world to address everything that is wrong with the home, so the assessor have to prioritize. And again, we provide tools to help the assessor come to that judgment of which one is more important than the other. Then the next columns basically is a hazard description, where they are located, where you find them in the house, to kind of like give some bearings to whoever is going to do the work down the road. There's some location where to find where are the hazards and where to find them, where they are located. And then the next slide is more a detailed scope of work. Whoever is going to do the work later on, could you go back 1 second? Yeah, whoever is going to do the work on the house, then those are the instructions. And the final slide is going to be those recommendations in the interim, what the client could do to basically mitigate the effects of the health impacts of those hazards. Next slide, please. And then once the scope of work is done, then it's given to the home educator or the client or the community health worker to basically now the community health worker or the home educator is gonna take the scope and create a family action plan in which they're gonna go a little bit more in depth on what other actions the client could do to mitigate the hazards, provide additional resources for the client, and provide them help deliver supplies to the clients like vacuum cleaners, smoke alarms, carbon monoxide alarm, and then also provide referrals to other partnering organizations. So basically, that's in a nutshell. That's what we provide at the end with the client education. And the next slide. So this is kind of like to give you an idea of what's the current application. In Baltimore, we are now implementing the virtual home assessment and the virtual home education approach into different programs. The AmeriGroup health insurance is we are like doing some asthma triggers assessment. Also for the CDBG grant, we are doing some healthy homes comprehensive assessment. Also, we're actually applying the platform for foster care homes, doing this health and safety inspection of foster care homes that are candidates they are applying to get a foster child. That's through the Maryland Department of Social Services. Then in Providence, through the Integra Care Insurance, we have been training some assessors up in Providence to do some asthma triggers assessment. And also that same group in Providence and another group in Memphis, all those tools, all those protocols have been translated into Spanish to also provide those tools to to Latino, Spanish speakers, contractors in those 2 cities. Next slide, please. And as for the general goal for us is to develop a toolkit in which everything that I have been mentioned to you, the protocols, the toolkit, the evaluation tools, the assessment tools, pre-assessment activities, best practices, we are all that writing all that down and creating all these documents and then have them available on the GHHI online, on the GHHI website. That's in development, but that's the general goal, is to have all that information out there and then distribute it across the US for people to be able to start implementing, and ideally for me to start like getting feedback from whoever is using those protocols to find out, okay, what's working, what's not, how to improve it. So that's going to be the plan, the long-term plan. And then next slide. And kind of in general, these are the conclusions for that we have reached so far. This virtual home assessment platform, when it's supported with detailed guidelines, checklists, and with the safety guidelines for the client, when we have all of that together, this virtual home assessment platform, we have found that it's useful. That is, we have obtained really good results by applying this new approach. I think we're really satisfied. The completed virtual assessment for us, we know that it's kind of early in the game, but they have revealed a higher than expected equivalency to in-house assessment. Equivalency because we are trying to measure what percentage, how close is the virtual to the in-person. Certainly, it's never going to be 100% equivalent, but the closer we get it, the best. And I think with what we have done so far, I think that we have, personally, I believe that I have reached 70 to 80% equivalency so far with the homes I have done. I mean, some houses are easier than others, but that's my experience so far. Definitely, we need comparative research needs to be done to basically measure that number, and that's in the plan to, once we get back to a more regular activity in which we can do home assessment personally, then we're going to develop some research to compare the two approaches in the same house. And then number 4, I think that this is a platform that is not only going to be used for during this crisis. I think that we have this platform, I see going to have a lot of value for many organizations out there, especially organizations that don't have all the resources in the world, but they're kind of like, there's some limitation in personnel and funding, that then it's you can accomplish a lot without having to send an assessor to drive miles for an hour to do an assessment. And so you can get a lot of information previous to the actual engaging a human to go to a house. And again, that's one of the examples. And then the fact that you are opening the resources, the services to a bigger group of people, clients out there. And the next slide, please. And I'm including here at the end some of the reference that I went through that I found kind of like they were kind of like touching on this topic of a virtual home assessment, virtual home inspections, or also they call it also remote home inspections. So kind of like those are 4 of the more significant reference that I found out there. Number 4, the one at the bottom, it was kind of like the most interesting part, because it was kind of in 2018, the National Fire Protection Association, kind of like they came out with this white paper, kind of like talking why, kind of like supporting the vision of start doing virtual home inspection for fire inspection. So in 2018, the National Fire Protection Association, they was already thinking on taking this approach to a higher level. I mean, fire inspection is a little bit more sensitive, but again, there's a lot of things that you can do virtually that is going to get you closer to that in-person fire protection, fire inspection activities out there. And I think the next slide, I think this is the, yep. So thank you for your time, and let's open it to some questions and comments.
Thank you so much, Hector. I think that was a fantastic presentation. You know, during these times, we are working more remotely, and I think this is a great example of how we can reach, you know, the community still. So we do have a few questions. I'll open up. So do you guys think that you will continue virtual assessments even after things get back to normal?
Yeah, definitely. What we have realized using the platform right now, it has a lot of potential for other applications. I mean, from just emergency, we get a significant amount of phone calls that we get from our clients that, let's say after an intervention, they call us, and after a home intervention, they call us maybe a few weeks later, calling that they might have they have been an issue with something that we did in the home, and sometimes that require for an assessor or for a crew chief to go and drive all the way to the home to find out what's going on. And now with this technology, basically the same way that people have been using it so far, it's kind of like you can do targeted inspections, like for emergency inspection, like and then you determine if it really is going to require someone from the office to drive, or you can already call a subcontractor to go and fix it. So it's kind of like it's going to help make your work more efficient. You're going to be able to reduce the amount of time that you're going to be in the road. Also check-ins with the client. There might be things that you want to touch base with your clients. In some of our programs, we have after we do the intervention, we have a 2, 3, 4. I'm sorry, like a 3, 6, 9 month touch. We touch back to our clients with our clients. So this would be a good way, not to make it just a phone call, but now we can do a virtual check-in to make sure that everything is fine, and then we can take picture. If there's something that relates to the home structure, then those pictures can be relayed to me or to someone in the crew. So yeah, definitely there's a lot of applications. From the quality control perspective, you can easily, especially if you use platform like Zoom, you can jump in an assessment that someone is doing, and then basically shadow that assessor, that home educator, and basically see how this assessor or home educator is implementing the guidelines or doing the work. And also from the same way around, if for teaching purposes, I can have some students jump in my assessment, so they can learn of how I'm doing the presentation, how I'm doing the assessment. So it has a lot of versatility and applicability in many things that we do in this industry.
Very good. Okay, the next question is, in your experiences, have families been more open to do virtual assessments than in-home assessments?
Comparing, I don't know if we should compare the two, because okay, like when I see the virtual, we were expecting that the families were not going to be so receptive to a virtual home assessment. But then when the way we design the process by having the project coordinator go ahead, like maybe a few days before the assessment, and basically explain everything to the client, make the client comfortable, answer all the questions the client may have. So it's kind of like you're kind of psychologically you're preparing the client to what's going to happen. I think that in the in-home virtual assessment, you don't get that kind of like preparation of the client on what's going to happen during the assessment. You have some, but it's not as in depth that as we are doing with the virtual. Basically, to give you an idea, in the past I would go to a home and spend 2 or 3 hours doing a comprehensive home assessment, depending on the size of the home. Right now, I cannot make that the client stay with me 2 or 3 hours. That would be exhausting for anyone, especially if that person doesn't have the training, doesn't have the PPEs or the safety tools. So what we have done, instead of spending 3 hours in the home gathering information, now we split it with 1 hour of me in the home actually doing the virtual assessment, and then 1 hour beforehand with the conducting a triage with the coordinator, gathering that information, setting up the platform, teaching the person how to use the Zoom or the Google Duo or the FaceTime, to how to use that platform. And then when the day of the assessment, it's kind of like everything kind of like goes smooth. And I think that has been my pleasant surprise, that I think in both, I think you get a similar type of receptivity from the client.
Okay. Okay, we have another question. What's the protocol if clients doesn't have a smartphone? So how is the assessment done?
Yeah, that's definitely there are limitations to the process, to the approach, and that's going to be one of the hurdles to conduct a virtual assessment. It's required that someone in the family could have a smartphone or a tablet. The good thing is like that for the most part, there's always someone in the family with the smartphone, and in those cases we kind of like we encourage the client to get the neighbor or to get a cousin or to get another person, another relative, to be present that day. And since it's going to be kind of a short in nature, so it's kind of like it's has worked for us. We haven't had I think I had only one time that we have issues with the communication with the platform, and we have to reschedule and then go for the coordinator to give more instruction to the client on how to use a different platform. But it had been mostly on, if anything, on the client being comfortable using a particular platform. That's something that they might not be used to. We always keep a backup. We try to do Zoom meeting because there's the capability to record the session. But if the person has some issues with Zoom, then most of the people are used to FaceTime. So if Zoom cannot work, then we switch to FaceTime and then continue the assessment.
Okay. Thank you, Hector. So we have about 20 minutes or so left. I just want to open up to the next point on our agenda. I'm just gonna share some updates with the coalition members, what we're doing, and then we will be able to, let me see, how does this work? So if you would like to share any updates for yourself as well after I go, then you can raise your hand for all the members, and I can share in the section in the chat what you're up to. Okay. So I just wanted to say also for anybody who is new, this is their first time, who has not attended our meetings before, just what we're about. We're dedicated to the elimination of childhood lead poisoning in New Jersey and the creation and maintenance of healthy and safe homes throughout New Jersey. Our educational program is geared towards children ages of 6 years old and younger, their parents, and pregnant women throughout northern New Jersey. So I'm here with Alanis, our program specialist, and Ismary, our program specialist. We're a team of 3, and prior to COVID-19, we've been out in the field throughout 8 counties of northern New Jersey. The girls do an amazing job of educating, our children, parents, etc. So during this unprecedented time, we are working remotely, as I mentioned before, and we still are eager to share the information that we have to work with families. So far, Alanis and Mary have presented to moms groups, to different groups, family success centers. So again, if you are interested in, or you know someone that could benefit from our program, please reach out to myself, Alanis or Mary, and we will be happy to coordinate that with you. So what we're doing right now, we have some healthy home and COVID toolkits that we're in the midst of working to disperse, and these toolkits will provide families with a tangible resource for creating safer environments within their homes, as well as protect against COVID-19. The toolkits will include a couple of things like hand sanitizer, coloring books, soap papers, a house-shaped sponge, duct tape, and that's used to cover chipping paint around like a windowsill or a exposed closet, an adult reusable face mask, a youth reusable face mask, a measuring cup, and informational sheet. So with the informational sheet, that includes a bit about our program, some information, some facts on COVID-19, some information on lead poisoning prevention, as well as healthy homes. Okay. So we're hoping to disperse 500 of these kits to 8 counties in New Jersey. I had sent out a mass email to our coalition members a few weeks ago, so we're in the midst of just working through the orders and trying to get that out. If you do have any questions about that, please email me privately. Okay, so other updates so far, we are getting creative. We have made some videos that are available on social media, some DIY creating your own face mask. We have some videos that show the importance of using soap during hand washing. That's kid friendly. And also the lead detectives video. So Alanis had read a lead detectives book, and we'll show that at the end of this video, well, at the end of this meeting, so you can watch a clip, a little highlight of what that is. So again, these are just some of the things that we have been doing. We're constantly brainstorming on ways to reach the public, reach the community, and still be active. As of right now, we don't know exactly, when we will go back to normal, if there is a back to normal. So as of right now, we are continuing to work remotely. Okay. So I would like to give you all the opportunity to share any updates. You can mention, your, let me see, raise your hand. Monica, how does that work?
People can either raise their hand or I can actually unmute everyone, but I would just ask that people then mute themselves if they aren't speaking so we can limit background noise. You want me to unmute everyone?
Okay.
Okay.
So if you'd like to share an update, you can. Okay, yeah. So how that'll work, if you are called on, you can mention your name, your organization that you work for, and any updates. I'd like to hear from you if you are working remotely as well. What are some things that you were doing? Is it difficult to reach the community right now? What are some, things that you've been working on? So.
Well, everyone's been unmuted, so they can unmute themselves if they wish to contribute or speak.
Crickets.
Okay, quiet group. No hand
Okay.
raises either.
Calling on people. I know I can't see you, but in our previous, meetings, we don't generally do give updates. So,
Is there anyone
see.
specific you want me to unmute?
We'll do it by county. So let's start off with Union County. Anybody here from Union County? Let me look in the. No.
No hand raises. If somebody even
No.
hand raises, I can help
Hudson
them.
County. Let's see. Okay, and the attendees, I see Carlos. I'm gonna call on some people now.
I see not on my list of attendees, I can see that some hands are up. I don't know if that's what that means, like a little icon.
I don't see that. Where is that in attendees? I see a question.
Yeah, in the list. I think I see some, but I'm not sure if that's Megan Sweet, Jamila, Donna.
Okay,
Puleo.
if you can see a hand raised, because on my end I don't see it. So feel free, as Mary, if you wanna call on someone who has their hand raised.
Okay, the first one I see is Donna Puleo. I hope that you have your hand raised. It's not just, that's what I think it means.
Looks like Donna's self-muted. Donna, you just have to unmute yourself.
Okay, I think I did it. Hi.
Hi.
How are you?
Good, thank you.
Good. So we're working from home, and what I've been doing is just, going on our Welligent site every day and checking on people's levels, calling the moms, trying to troubleshoot over the phone. Sending packages of literature to the moms, especially the new cases that never had experience with lead before, and then just waiting like a week and calling them back and reviewing it again and asking for questions. But we can't inspect anything right now, and I don't know how soon we will be able to do that, but I just explaining them everything I would normally do on a home visit. So that's what we're doing. Is anybody doing anything differently?
Donna, could you say where you're from again and
I'm sorry.
what area?
I'm in Passaic County. I'm in Passaic Health Department. I'm sorry.
Okay, thank you.
Sure. Any other towns doing anything differently? Because we really didn't get any good guidance from the state on how they wanted to manage the lead cases. I've been doing the COVID cases since March, so I'm just sort of squeezing in the Welgent stuff because we weren't really given any guidelines, like how quick we need to connect with those folks or things like that. I have health insurances calling me asking for updates, but we can't really inspect. So just curious if anybody else has been given any state guidance. No.
Okay. Anybody else? Any other health departments? Hudson, health department, what are you guys up to? No.
I think the next raised hand that I see is Megan Sweet.
Megan is self-muted.
Okay, hi everyone. Can you hear me okay?
Yes.
Yes.
Okay, great. My internet is a little slow, so hopefully it comes through okay. But my name is Megan Sweet, and I'm with Greater Newark Conservancy in Newark. And so we've been working remotely and creating videos for families, which are on our website, and I can share that. If I put that in the chat box, can people see that or?
Yep.
Okay. So we've been creating videos, and then we're also doing virtual family programs. So once a month, I've been doing a Facebook Live cooking program. So anybody can tune into that. And it's been a little tough to reach families. We try, emailing early childhood centers, and they pass that on to their families, but it's hard to really know who we're reaching. But I can share our website, and then if anybody wants to follow us on Facebook, we are doing a lot on Facebook Live in terms of virtual programming. And then kind of peripherally, I also want to mention that we have free seeds to give away. So if anybody's interested in that, I can share our Google form. So we also want to make sure that families can grow their own food during this time. So yeah.
Okay, thank you so much for sharing that, Megan. If you are in the chat where it says to, just make sure that you can share it with everybody. So question 2. Organize parents, presenters.
If you put it in the question box, we can copy it to chat with all attendees.
Okay.
Okay.
So with the food, is that coming from like a food bank, or are you guys like growing your own food? The ones that are sharing. Megan?
So the Conservancy, our urban farm is up and running. So they have not been working remotely, our farming team. So we are growing our own food, and we've been participating in an emergency food distribution, but that's really targeted at senior citizens in Newark. We don't really have the capacity to include families, at least right now, but we're hoping to open our farm stand in July and follow COVID practices for social distancing and curbside pickup. So I can share that information once we have it.
Okay.
But then in terms of seeds, people can come to our office and pick up seed packets if they want to grow their own food.
Okay. Very nice. That's awesome. Okay. And this is for which residents? Newark residents only?
Priority to Newark residents, but then we're open to including others as well.
Okay, good to know. Thank you so much.
Thank you.
Okay. All right. Lastly, anybody else? No. Okay. All right, so at the end, we're going to show the lead detectives reading that Alana shares with children. So if you want to hang around and see that, you can. I want to thank you so much for joining me today and my team. A special thank you to GHHI. Hector, thank you for speaking and sharing us your presentation. Virtual assessments is, that was a fantastic presentation. So I miss seeing all of your faces, but we are in different times. So hopefully we will get to see each other again soon. Everybody stay safe, stay well. And, as always, if you have any questions, if you want to collaborate with us, feel free to reach out. Okay, we are on social media platforms, Facebook, Instagram, Twitter, YouTube. So check us out.